Florence Nightingale Hospitals was established in 1989. There are 4 general hospitals and 2 medical centres with a capacity over 800 beds, 40 operation rooms, 141 ICU beds and 50 emergency beds. There is also a teaching hospital, Demirolu Bilim University. Group Florence Nightingale Hospitals are located in the centre of Istanbul and has been serving for over 30 years as the most prestigious and important hospital group within Turkey. Since 2004, more than 1,500 liver transplants have been performed, with over 80% being live donors. Approximately 100 liver transplants are being performed every year at our hospital group. Liver transplant is not only about the operation taking place, it is about the multidisciplinary perspective that covers all of the processes, from the expertise of the logistic team, ICU team, our expert hepatologists, radiologists and surgeons, as well as the pre- and post-operation care and operating room.
Hi everyone, I'm Dr. Tolga from Florence Nightingale Liver Transplantation Center. I am working as a transplant hepatologist for 3 years in our center. We have performed 1,500 of living donor liver transplantation and cadaveric transplantation in our center since 2004. We have a success rate of more than 93% after liver transplantation in first 1 year, with no donor deaths. Preoperative evaluation and postoperative close follow-up is the most important thing in liver transplantation period, and transplant hepatology has a key role on all this process.
Over the last decade, there has been a rise in the use of radioembolization as a locoregional treatment. It can be used in advanced hepatocellular carcinoma patients who are not candidates of liver transplantation, and also as a bridging and downstaging treatment to liver transplantation. The procedure of radioembolization is injecting microspheres containing radioactive material into the hepatocellular carcinoma feeding vessels under the guidance of digital subtraction angiography. Radioembolization is an effective treatment modality for hepatocellular carcinoma with its high response rate, long time to progression, high quality of life and low side effects.
It is very important for patients to have a good support system from friends and family throughout this journey.
A friend of mine told me that your treatment can be done from Florence Nightingale Hospital in Istanbul. When I landed over here, I was received with a very efficient staff, and the pre-operation treatment was excellent. The operation went very well. The doctors here are very competent, and the nursing staff was all praises to them. They were very nice, and they made me a very satisfied person.
We first treated our patients, and now we teach people how to treat their patients. We continue to perform transplantation, and we continue to teach people how to do transplantation. And this is a very enthusiastic and enjoying procedure. You teach and you treat.
In the United States, always the volume of live donors are not very high, maybe 200 to 300 per year maximum. Versus in some Eastern countries, maybe in Turkey is one of them, they can do as many as 100, 125 per year. It's important for the live donor physicians and the surgeons, but most important the surgeons, get their initial experience and further experiences and training in high volume live donor liver transplant centers. I think Florence Nightingale is one of the unique places around the globe that is offering that kind of an option, both for the physicians and most importantly for the surgeons to get their further experience.
Group Florence Nightingale Hospitals has an amazing living donor liver transplant program. From the year 2004 to the present day, with all of the technical achievements gained, liver transplantation is a simple and reproducible operation. The liver transplant team at Group Florence Nightingale Hospitals is tirelessly working for the patients and their relatives. The team is dedicated to lower the mortality rate near zero with the highest patient satisfaction.